In many rural villages, life is shaped by close family ties, traditions, and community bonds. People rely on one another for survival, working together in farming, fetching water, or caring for children. Yet these same villages face serious challenges: poverty, health problems, gender inequality, and disputes that affect not just individuals, but entire families. This script explores these challenges in the context of rural living. It looks at health and hygiene, the role of women, family conflicts, and the importance of community support. While specific stories highlight these realities, our focus is on the broader lessons that can help us understand and find solutions. The living conditions of villagers. Many villages around the world are isolated, with homes built from mud, wood, or other natural materials. Roads are often rough or non-existent, making it difficult for vehicles to reach families. Daily life involves long walks to fetch water, farming small plots of land, or doing manual labor for survival. While these communities are resourceful, limited infrastructure means basic needs, like food, clothing, and clean water, are not always guaranteed. Children may grow up without access to proper schools or health facilities, leaving families trapped in cycles of hardship. Health and hygiene challenges. One of the most pressing issues in rural areas is hygiene. Without access to clean water, people often rely on rivers or ponds for drinking, cooking, and washing. Unfortunately, these water sources can be contaminated, spreading diseases such as diarrhea, typhoid, and cholera. Sanitation is also limited. Many households do not have proper toilets or waste disposal systems. This not only pollutes the environment, but also increases the risk of infection. Poor hygiene practices can weaken immune systems, making even small illnesses dangerous. An example of how poor hygiene affects health is the spread of jigger infestation. Jiggers are tiny parasites that burrow into the skin, usually around the feet, causing pain, swelling, and sometimes disability if untreated. They thrive in dusty, sandy environments where sanitation is poor. While the condition can be treated, prevention is far more effective. Wearing shoes, maintaining clean living spaces, and educating communities about hygiene can greatly reduce the problem. Environmental factors. The environment plays a big role in health and survival. In many rural communities, farming is the main source of income and food, but climate change, soil degradation, and lack of modern farming tools make agriculture unpredictable. When crops fail, hunger and malnutrition follow. Deforestation and poor waste management also affect villages. Cutting down trees for firewood reduces forest cover, leading to soil erosion and water shortages. Trash often ends up in open fields, contaminating land and water sources. Without sustainable practices, communities face long-term environmental damage that directly impacts health and living standards. Social and cultural pressures. In addition to health and environmental issues, cultural pressures sometimes complicate life in villages. Traditional roles and family disputes can leave vulnerable individuals, especially women and children, without the support they need. Conflict within families may result in neglect of basic responsibilities, further worsening the cycle of poverty and ill health. Strong cultural traditions can provide unity and identity, but harmful practices, like denying women access to resources or stigmatizing illness, need to be addressed through education and awareness. Finding solutions. Improving life in rural villages requires practical and sustainable solutions. Access to clean water, installing wells, water filters, and rainwater harvesting systems can reduce waterborne diseases and save time for families, especially women and children, who often spend hours fetching water. Sanitation and hygiene education, building latrines, encouraging hand washing, and teaching communities about disease prevention are low-cost interventions that have a high impact. Healthcare access, mobile clinics, and community health workers can bring essential services closer to remote areas, providing vaccinations, maternal care, and treatment for common illnesses. Environmental protection, promoting tree planting, renewable energy, and sustainable farming practices can protect the environment while supporting livelihoods. Empowerment through education. Education equips children with knowledge and skill to break cycle poverty. Schools that emphasize health, hygiene, and environmental care can create long-term change. Community participate. Local leaders and villagers themselves must be at the center of solutions. When people take projects last. In the end, The struggles faced by rural villagers highlight the importance of health, hygiene, and environmental care. While challenges like jigger disease, poor sanitation, and food insecurity seem overwhelming, small steps can bring lasting change. Clean water, education, sustainable farming, and healthcare access are not luxury. They are necessities for a dignified life. By raising awareness and supporting initiatives that focus on these areas, we can help break cycles of poverty and illness. Every individual deserves the chance to live in a safe, healthy environment, no matter how remote their village may be. Together, through education and action, we can build a healthier, more sustainable future for all communities.